Today I am going to speak on living well with the kidney diseases. First of all, we will see what are the various forms of kidney disease. There is acute kidney injury, chronic kidney disease, hereditary kidney diseases, glomerulonephritis, nephrotic syndrome, nephritic syndrome, and disease also with where there is alteration in the electrolytes such as hyponatremia, hypokalemia. Okay, so what is acute kidney injury? So acute kidney injury is a disease where there is worsening of the kidney function in hours to days, and it is associated with the rise in serum creatinine, fall in urine output, and there are various causes for acute kidney injury. It can be sepsis, infection, fall in BP, drugs such as antibiotics, toxic antibiotics, and painkillers. So, in a milder form of acute kidney injury, we just need to give a conservative line of treatment. But in a severe form, patient may require a temporary hemodialysis. What is chronic kidney disease? So, chronic kidney disease are the diseases where the creatinine increases progressively and slowly over months to years, and the kidney function deteriorate over months to years. And the risk factor for chronic kidney disease, the most common risk factor is the diabetes mellitus, followed by hypertension, kidney stone, hereditary kidney diseases, CTID, elderly population. So these are the risk factors for CKD. And what is the screening test to detect the CKD? There are simple tests to detect the CKD, such as serum creatinine, urine protein creatinine ratio, and sonography. So these are the simple tests by which a person can detect a CKD. So there are 5 stages of CKD, and the CKD stages has been classified depending upon the EGFR, and EGFR is calculated from serum creatinine. And suppose if the EGFR is less than 15, then it is called a stage 5 CKD. Okay, and the management from stage 1 to stage 4 is different, and for stage 5 is completely different. So management of stage 1 to stage 4 CKD is by control of blood pressure, control of sugar, then avoiding the nephrotoxic medications, then diet. Diet play an important role in CKD. So first thing is fluid intake, that is water intake. How much water should be taken? So it depends upon the patient urine output, and it depends from patient to, it differs from patient to patient. One patient we may allow only 800 ml of fluid, the other patient may be taking 2 liter of fluid. So it is individualized, and I cannot tell you in this video. You need to meet your nephrologist and decide. So second is salt intake. Salt intake should be restricted to less than 4 gram. Okay, and followed by that the protein intake. Protein intake is important. See, the kidney patient, kidney patient who are taking 1.2 or 1.5 gram of protein has been seen to have a rapid progression of kidney diseases. Okay, and restriction of protein intake, that is 0.6 to 0.8 gram per kg per day, is been associated with slowing of progression of kidney diseases. Okay, and potassium intake also depend on the serum potassium, so it need to be individualized. And from stage 1 to stage 4, in stage 4 patient need to get prepared for the renal replacement therapy. So what is renal replacement therapy? When patient come to stage 5 associated with the uremic symptoms such as nausea, vomiting, leg swelling, accumulation of fluid in the chest causing breathlessness, and encephalopathy. So along with this, patient need to initiate on renal replacement therapy. So there are 3 types of renal replacement therapy. First is hemodialysis, second is peritoneal dialysis, and third and the best one is the kidney transplant. So two form of kidney transplant. One is live related kidney transplant. The other is cadaveric kidney transplant. Okay, and the best form is kidney transplant, and the other two can be choose depending on the patient. I want patient and their relative to actively participate in the selection of kidney therapy, whether they want hemodialysis, peritoneal dialysis, or kidney transplant. And not doctor should not say you that you take this thing. Patient should actively participate in this thing. Okay, so after this, what is preparedness? So before the starting renal replacement therapy, patient should get prepared for renal replacement therapy by formation of AV fistula. If the patient has decided that I want to go for hemodialysis, make a AV fistula early. By the time you require a dialysis, it should be prepared. Or insertion of CAPD catheter if you want to go for peritoneal dialysis, or searching for a donor in the family and doing its testing and finding out whether the donor is fit to give kidney or not. So this is called preparedness at the stage 4. So after this, patient also need to be referred to healthcare professionals such as dietitian to have a proper prescription about diet, then social worker and mental health professionals such as psychologist or social psychologist or psychiatrist. I want patient to have a near normal life. Means patient should take a dialysis or peritoneal dialysis, and along with that he should do all those things which he was doing earlier. For physical health, patient should do a walk 30 minutes to 1 hour per day, do a, aerobic exercises, yoga, meditations. This thing can be done to have a good physical and mental health. Treatment of CKD is costly and you need to plan in advance. So those patients who are at high risk for kidney diseases such as diabetes, hypertension, then kidney stone patients and hereditary kidney disease patient, such patient can do a mediclaim or insurance earlier so that they can get a benefit when they require a treatment for kidney disease, CKD, such as dialysis, transplant or peritoneal dialysis. And there is also this patient can also take help from charitable trust or social worker who do provide a financial help, and there are also charitable trusts who provide a dialysis at a lesser cost. So kidney patients are susceptible to infection, and hence vaccination play important role in preventing such infection. So which vaccination should be given? The vaccinations such as hepatitis B, which involves 4 doses of hepatitis B vaccination, then influenza vaccine, which need to be repeated every year, then pneumococcal vaccine, which need a booster dose once in 5 years, and now since the pandemic is there, COVID-19 vaccine. When you should meet a nephrologist? So if you have a nocturia, meaning passing more than 2 times urine in the night, frequency of urine, more frequently if you are going for urination, if there is foaming in the urine, if you're passing the urine and there is lots of foam developed in urine, then you should meet a nephrologist. Hematuria, dysuria. Dysuria means painful urination. If there is associated swelling in the leg, puffiness of the face, if there is rise in creatinine more than 1.5, or urine routine, urine examination shows there is protein present or RBC present, blood present, and if there is either decrease or increase sodium or decrease potassium, in such condition you need to meet a nephrologist. So early diagnosis of the kidney disease is important. So if we can find a reversible cause and treat it, kidney disease can get reversed, or at least we can take a measure where we can slow down the progression of kidney diseases and delay the initiation of dialysis. I want to tell one quote from the CKD patient that he said, I don't want to think about dying from a kidney disease. I want to be able to live well with the kidney disease.